Next, we're focusing on a common childhood condition which many parents and carers don't know anything about until it happens. Febrile seizures are caused by a high temperature and can affect children up until they're 5 years old. Our reporter Julie McCulloch spoke to a mother who has urged every parent to know how to manage them.
What's that on the TV? Is that a lion?
Wow.
2-year-old Hannah is completely fine now, but 3 weeks ago she took a febrile seizure in the middle of the night, and her mum Tracy, who's a nurse, didn't know what was happening.
Her eyes were rolling, she was foaming at the mouth, her lips had gone blue. Luckily enough, the seizure only lasted about a minute, and then she went into really deep sleep, but she was unresponsive. I thought she was going to die. I just couldn't understand why my daughter was taking a seizure, perfectly healthy child. I just thought she was dying.
That's what most parents believe, but actually it's a much more common condition than you might think.
Febrile seizures are a type of seizure which can happen in children between the ages of 6 months and 5 years with a temperature. It is very common. Just putting in a perspective of 1 in 20 to 1 in 50 children would have had febrile seizure by the age of 5 in UK and Ireland.
In fact, while we were filming at Daisy Hill Hospital, baby Jake was being monitored after having one.
If your child does have a febrile seizure, it's important to do a number of things. The first is to call for help. The second is to get the child into the recovery position. Now, Janine, you're a doctor in the children's ward, and Catherine, you're a nurse on the children's ward. Can you show me how to put her into the recovery position?
Yes, to put the child into the recovery position, put the arm closest to you, up to their head. The hand furthest away, just bring it across their body and put the back of their hand to their cheek. Gently lift their knee furthest away up and roll the child gently onto their side and open their airway.
And then you have to make sure not to put anything into the child's mouth and not to stop the child making the jerking movements. And then, of course, to phone an ambulance.
Yes.
And to time the seizure.
I think every parent should be trained in first aid, at least how to manage a seizure. Particularly in antenatal classes, they should be covering this.
There's no way of preventing a febrile seizure, but if you know your child is unwell, the advice is to keep their temperature under control. Julie McCulloch, BBC Newsline.
Certainly something to take note of. 100 years ago,